Hi, everybody. Is this microphone on?
Hello?
Can you hear me clearly? You can. Good. Mary just said, is her microphone on? And
Hello?
I said, I dare you to sing into it. That would be much more amusing. Ladies and gentlemen, thank you for coming. This is going to be your BS-free guide to skincare, aesthetics, and surgery. And what we're going to do is we're going to take you on a personal journey that most people tend to go through throughout their life. We are going to start with great skincare from a brilliant consultant dermatologist who I've had on my channel many times. This is Dr. Mary Sommerlad, and she is one of my top 5 go-to consultant dermatologists in the UK. She is tried, true, tested, trusted, and I believe every word she says, and I don't believe many people in the beauty industry now after 33 years of doing it. Next across is somebody who, if you follow me, you will know really well. This is Dr. Wassim Taktouk, who is my aesthetic practitioner of choice. I would like to say, off the TV, Dr. Wassim Taktouk, because if you were watching This Morning last week, we were on This Morning together talking about salmon sperm, and that will come up again in conversation today, I promise you. And then on the far left, somebody who I have followed but met for the first time today, and that is a brilliant cosmetic surgeon, plastic surgeon, and that is Mr. George Orfaniotis, and I had to know how to say that. So it's a mixture between being an orphan and a naughty child, as he said. And he's one of the UK's leading plastic surgeons for the face and neck area. And we're literally going to take you on what would be a typical journey for most women as they get older. We're going to start with skincare, go on to aesthetics, and finish with surgery. So without further ado, let's start some questions. And I started by saying that I think I'm famous for a BS-free approach to beauty. And what I love about all of you is you are plain talkers, and I believe that you absolutely deliver. So let's start with the first question for you. If you're going to invest in skincare from a consultant dermatologist point of view, is there such a thing as clinical skincare? And what skincare, when should you make the move from being on the high street to seeing a doctor?
Thank you, Nadine. So clinical skincare, I think, is more of a marketing term than a term that a consultant dermatologist would understand. We have over-the-counter skincare. These are things you can purchase, you can buy. And then there is prescription medication. This is something that a doctor can prescribe. The ingredients will be stored differently, manufactured differently. And I would urge anyone, if you have a persistent problem with your skin, maybe you keep breaking out, maybe you have a lot of pigmentation that keeps coming back, your skin is tight, itchy, uncomfortable, please see a dermatologist sooner rather than later. It's better off to get a diagnosis. It's better off to get put on a treatment plan, which may include over-the-counter skincare products, but often prescription skincare formulations that would just be aimed at tackling your skincare problem. So when it comes to the term clinical skincare, I would say, if it's something you're buying, then this is more of a marketing term. If it's a prescription that you're taking from a doctor, then this is medical treatment, prescription strength, and these things are made in different ways.
Okay, so I'm going to ask you, what should you save and what should you splurge on when it comes to skincare?
Okay, one of my favorite topics.
You were so good on that live. You were brilliant that I did with you.
So very quickly, and I'm happy for anyone to come and find me afterwards to have a deeper dive, save on your cleanser. The most important thing about your cleanser is it is removing your makeup, your sunscreen, any product. It has contact with your skin on average for less than 2 minutes, and most of the time we're also washing off our cleanser quite quickly. Your cleanser just needs to mean that your skin doesn't feel tight, too dry, too uncomfortable afterwards. For some of you, that will mean you need to use a more balm or cream-based cleanser. For others of you, you may benefit more from a gel-based cleanser, but it doesn't have to be something expensive. It's something you're using often once or twice a day, every day. So save on your cleanser. Serums I would invest in. It's one of the few times where I say, actually, the ingredients in your serum. So let's take, for example, your retinoid serum in the evening. You can have a retinoid serum that doesn't make your skin feel uncomfortable, doesn't make you peel, and is very, very effective. And you can have a retinol serum that actually you feel it makes you peel a lot, makes you feel tight, maybe your skin just doesn't feel comfortable and so you barely use it. It's worth spending a bit of time and a bit of money looking for that serum that suits your skin really well. Moisturizers, I really believe your moisturizer's job is to hydrate your skin and help your skin feel smooth. I think it's a personal choice on how much money you want to spend on that. As a dermatologist, I would say your moisturizer could be high-end, it could be high street. It doesn't have to be incredibly expensive. Your sunscreen very much has to be something you'll use every day and you're happy to reapply. I have lots of patients who say, I can't use my sunscreen every day because it costs me £80, so I only save it for special occasions and I only use my sunscreen when I use it. So actually on your sunscreen, again, it has to be something you're prepared to reuse, buy frequently, use daily, but it doesn't have to be something very expensive.
And when should you make that move from, you, and you hinted at it earlier, when should you make that move from using over-the-counter skincare to maybe seeing your GP and then a stepped approach to seeing a dermatologist? What should we expect from our skincare, and when does it fail, and do we need medical intervention?
Yeah, so I think when we think of our skin, I always think of it almost like a Venn diagram. So we have our skin for grooming, and this is where your skincare comes in, your cleansers, your moisturizers. They're there to kind of support you day to day. Some of them will have some benefits, brightening your skin, smoothing your skin, smoothing out fine lines. Then you have your aesthetics, which is more like the beautification of the skin. And then you have your dermatology side. This is everything to maintain healthy skin and also diagnose skin diseases. Your over-the-counter skin care is not going to treat a skin disease. So I would urge you, as soon as you notice something is changing, not improving, it's better to see your GP or see your dermatologist as soon as possible than to wait. Because we know the sooner we treat, for instance, acne, active eczema, melasma, the better our outcomes can be. But it's also that emotional impact of waking up in the morning and uncertain what your skin's going to look like because you have a medical condition. So think of your over-the-counter skincare as really there to part of your kind of grooming of your skin. You may have some minimal effects from maybe smoothing out lines, helping fade some pigmentation, maybe a bit of freckling from holidays. But once you start having a persistent problem, doctor straight away.
How many skin cycles? So are we talking, as a journalist who's written about skin the whole time, I say it's going to be a minimum of 6 weeks, which is a skin cycle, which is the time your skin cells take from going from the base to the very top of the surface, to even see a cosmetic effect from, say, a retinoid or a vitamin C.
Yeah.
So if, for example, you're using an over-the-counter salicylic acid to treat breakouts, 3 skin cycles and then see a doctor?
Yeah, well, I think that's a really good beginning step, but I'd also say if you have a big breakout, so it's the severity, if you find that you're breaking out, you're getting new spots pretty much every day, then actually that salicylic acid may not be doing much for you. If we're more talking about a few blemishes, maybe scattered here and there, then give it a try. But again, if this is something that's just continually happening and you're finding that you're often looking for the treatment to help blemishes, please see your dermatologist, because at least we can guide you on whether you need prescription treatment that will save you a lot of money in the long run. That's another issue I see is people have spent sometimes
so much money,
thousands of pounds and years on over-the-counter treatment, and I prescribe them one tube of a prescription treatment and their skin problem dramatically improves. So I think there is the time frame, but there's also that cost impact and there's also the emotional impact. So if it's impacting on your day-to-day life, and definitely it's widespread, maybe you're thinking about it, maybe people are talking to you about it, see a doctor sooner. When it comes to using your skincare because maybe you have oily skin, maybe you want to brighten your skin a bit, then definitely at least 6 weeks. And be consistent as well. So if you've invested in a new vitamin C, for instance, try and use it as directed, which will usually be at least every morning for you to get the benefit from it. And actually, if you use it and you really don't like the product and it's not suiting you, then you're better off actually looking for something else rather than not using something that you've invested in.
And I'm going to ask you this because I can't get you here and not ask you this. What's on your bathroom shelf?
My bathroom shelf, so...
We all like to have a peek around that bathroom shelf.
So I keep my skincare routine extremely simple. I have really sensitive, dry skin. I get a lot of eczema. So I have a high street shop cleanser. It's a balm cleanser, which I like to use in the evening to get
names.
Oh, am I allowed to name names?
Of course you're allowed to name names.
Okay. So my current cleanser is Superdrug Vitamin E. It's fantastic. My serums. So at the moment I'm using the Relevant Vitamin C. It's a 15% ascorbic acid. I went to a talk from the founder, and she was incredibly...
Niako, she's amazing.
Incredibly inspiring, and it's a really beautiful vitamin C. I'm then using Vichy Mineral 89, their moisture boosting moisturizer. And then my sunscreen is Medicate. I love it, Advanced Day. At night time, my retinol at the moment actually is the Elizabeth Arden HPR retinol.
We're going to go on to talk about this, aren't we?
And I really love it because I've been able to use it non-stop without having to have any skip days. So I will often skip my evening retinoids in the winter because my skin's super dry and it just gets super flaky. And that's it. I don't exfoliate with anything. I just stick to a retinol because I think that does everything for me. I top up with nano laser peels. So one of the benefits of being a dermatologist is you have access to energy devices, and I think it's just great for keeping my skin feeling smooth and radiant. But on the shelf, 4 things, very simple.
What's trending in skincare now?
Okay.
Good, bad, and indifferent.
So I was really nervous about saying what's bad in case someone says, hold on, that's my company you're talking about. So interesting things. Ectoin, I think everyone's reading more and more about this ingredient. It's actually an old one that's coming back in. It has some anti-inflammatory effects, some hydrating effects, also some antioxidant effects. So I think it's going to be added to a lot of moisturizers.
My face is slathered in it.
Perfect. Other thing is the HPR. So this is a type of retinoid. So retinoids are like the vitamin A's that go on our skin in the evening. Dermatologists love them because they help smooth the skin, firm the skin. They help pigmentation issues, and they can help with blemishes as well. So they're a real all-rounder. If you're not using one, please introduce it to your skincare. So HPR is a type of retinoid that's very well tolerated. The full name is something like
hydroxypanacolone retinoate.
Real mouthful. It's well tolerated even if you have sensitive skin, mature skin types, dry skin. It's an exciting one. And then beta-glucan. And that's really exciting because, again, it's another one that's coming back in. You'll find it's got very soothing effects, very hydrating effects. It draws moisture into the skin. It's being reformulated into lots of products. So I think those are 3 exciting things. And then I think I'd spend the whole afternoon talking about things I'm dubious about. The latest one thing I recently heard about was scorpion venom. Not sure
I remember
yet.
when bee venom was huge about 20 years ago.
But so I think 2024 there'll be a lot of exciting things, but I think those are the 3 kind of trending, and it'll be exciting to see where they go.
Now, talking of trending ingredients, I mentioned earlier that I was on TV with my next guest, Dr. Wassim Taktouk, because we were talking about salmon sperm, and I kid you not, and it went viral. But let's discuss, Wassim, you're the aesthetic doctor I trust in this industry. I think you're very careful, very considered. When do aesthetics take over from skincare?
I don't think they ever really do. I don't think there's sort of a handing over of the baton. I think that whatever the principles are and the treatments that you do have within your skincare are things to be implemented through the rest of your life. there are things that skincare can't do. But there are also certain things that skincare can be used for to prolong the results from the treatments that we do. So, for example, if you're having dermal filler injections or skin boosters, you can use topical hyaluronic acid. SkinCeuticals, as you know, I'm a big fan of. They have an HA intensifier, which has purple rice and licorice extract, which blocks the breakdown of hyaluronic acid. So there are things that we can do. So there's a sort of a crossover, in answer to your question, but we don't lose sight of the principles of skincare.
So what can aesthetics treatments do that skincare can't?
So, well, within the realm of skin, we will do a lot of skin resurfacing. We will polish skin, polish fine lines and wrinkles. We will boost the skin, restore glow and health to the skin, deliver nutrients. So there's a lot of stuff that we can do besides the Botox and fillers, which are sort of a little bit more targeted to fine lines and wrinkles or restoring volume. So skin boosters and really just improving the skin quality.
Okay, talk about the skin boosters and how we ended up on this morning, and you said the word sperm on live TV.
Yeah, so that's, I'm not into fads, so disclaimer is that polynucleotides have actually been around for a very, very long time. They've been used in Korea since 2014. They're very safe, they're very effective. And you have to think of them as your cells need to be able to repair themselves. And what polynucleotides are, they are extracted from salmon sperm. I don't extract them myself, but they are washed and they are purified, and 95% of them is still patent. And you have to think of them as almost the spare parts for your cells to be able to regenerate themselves. So once they're injected, stem cells come along, they produce more collagen in the area, blood flow is increased, so you get more blood and you get more nutrients to the area. They help neutralize free radicals. There's a whole bunch of stuff these polynucleotides do, and they're really exciting at the moment, but they have been around for a while.
They fall under the skin boosters category. So if I was to ask you to choose your top 3 aesthetic treatments, I presume one would be Botox, one would be filler, and then the other one would be skin boosters. Do you want to chat about what each 3 of those do to anybody that's uninitiated?
Yeah, so within the skin boosters, besides polynucleotides, we obviously have actual injectable hyaluronic acid. So that might be things like Redensity 1, which are sort of a cocktail of ingredients, amino acids, zinc, copper, vitamin B6, a host of antioxidants in there. So all the stuff that you kind of put on your skin topically, but actually you're injecting it and getting it into the skin.
And is this true that these are the sort of the injectable moisturizers, aren't they? So they don't change the shape of the face or the way a traditional filler would?
Exactly. And for those almost nervous in the first instance to have any kind of injectable, this is exactly what you start with, is a skin booster. So you might have that's a Redensity 1. There is another one which is called Bellaterra Revive, and this has hyaluronic acid with glycerin in it. It's great for hydrating the skin. Profilo has been around now. It's quite a well-known one. That is pure hyaluronic acid. So those are the ones that are sort of hyaluronic acid-based. But you do have sort of the other ones that seem to be becoming a bit of a comeback. So they're the biostimulants. These are the ones that work with your own body. So when you inject these products into the skin, they come along and wake your skin up and make it start making more collagen. So they're going to be things like Sculptra, like Elance, Radiesse. So these ones are all kind of creeping back in. They never really went out of fashion, but for a while I think that the hyaluronic acid fillers were kind of taking over a fair bit.
Well, can I play devil's advocate and say,
yes.
do you feel that there is a little bit of a wariness or a backlash against filler?
I think as with any treatment that can be overused, there will always be a backlash. And I think that filler represented something at a certain moment in time where you were able to fix something very quickly, and that was it. It was instant. You didn't have to be patient. You'd walk out with a new set of lips, whatever it may be, and it got abused. But actually, filler is still my favorite treatment to do. And I think filler, when done correctly, is beautiful. When you can understand and appreciate how the face ages and what the volume is that you're replacing, there is nothing like it. You need to fill. I mean, you have pockets of fat that diminish as you get older and descend, and so you have to be able to use filler correctly. So I think it's a bit unfair, and that goes on with what we were discussing earlier. It's to do with what is good work. Because you always can spot someone who's had bad filler. You don't want to be that person in your group of friends. You want to be the one that everyone's looking at saying, what's going on here? I can't put my finger on it. It's really irritating me. And then you bitch about her on the text message with each other. But that's who you want to be. You don't want to be the person who comes in, Freddie Fish Lips. These are the kind of things that went wrong. So filler did get a bad rep, but it's also, again, the product. So not all fillers are created equally. We work in the UK. There are over 200 different brands of fillers here. They're not really regulated. And so I think you have to also think about your skin, your natural tissue. It's not HA anymore, it's RHA. So it's resilient hyaluronic acid. It's filler that moves with your face. So it doesn't lump, it doesn't bump, it integrates naturally into the tissue. And that's kind of where we're going with it.
And
It's quite a
explain
long answer, wasn't it? Sorry.
neuromodulators. I shouldn't use the word Botox because it is
Yes.
one particular brand. That's like saying Hoover for vacuum cleaner, by the way. And explain what neuromodulators do to the uninitiated.
So neuromodulators, so muscles contract from a signal from a nerve. So nerve comes along, sends some neurotransmitter and tells the muscle to contract. The neuromodulators, the B word, come along and block that from happening. So the muscle can no longer contract. Our bodies outsmart it. They're much smarter than that. And over time, we get new nerve terminals to send neurotransmitter. But that process takes about 3 months. Again, a really lovely treatment. It's very predictable. It's very safe. And yeah, I mean, that's what Botox is. It's for fine lines and wrinkles. It can be used, again, for lifting, the dreaded word. You can do neck lifts with it. You can lift downturn corners of the mouth. As we get older, our muscles get tenser. So muscles start to pull down in different areas. So if you can relax those muscles, you kind of get this consequent lift, as it were, because you're blocking all the vectors that are pulling down.
Now, machinery and gadgetry is huge in aesthetics. You seem to be very circumspect and very measured in your approach to machinery. I know you work with an amazing professor. If you follow the Taktouk clinic, and there's a professor that works there that does the most incredible laser work on port wine birth stains, port wine stain birthmarks. Let me get that right. When do you decide to invest in a piece of equipment or machinery, and what do you demand from a piece of aesthetic equipment?
I think it's a good question. I was never one that rushed into any kind of decision with the machines. I didn't want to sort of be able to do a little bit of everything, and I wanted to sort of master one thing before moving on to the next. For me, it wasn't about the fads. I'm not sort of drawn into the latest one that's that's covered in the press, or looks like it's pretty wonderful and so forth. I have an ace up my sleeve. I have a Professor Faraz, a professor of dermatology, and I was very clear in what I wanted. I wanted a machine that I could learn, use very well, that was a technology that was well researched, did well, could be used on all skin types for multiple uses, and that's the fractional CO2 laser that we have. He guided me.
The thing about the fractionated CO2 you have as well is you can control it so well, can't you? So, for example, you can give me a treatment and have 2 or 3 days downtime, and then you can do full surface ablation as well. It's very clever. Explain how it works.
Yeah, if you think about the traditional CO2 lasers, it's almost, think of a tub of ice cream, and you've got to have an ice cream scoop, and you scoop it off. That's how the CO2 lasers used to work. You used to take that top bit of the skin off. Downtime was horrific. Everyone looked a bit like Freddy Krueger, but then you had this wonderful baby bum skin at the end of it, and it was wonderful. But people just don't have the time to do that now. No one wants to take 2-3 weeks off work. And what this does instead is it almost creates these little channels, and so it leaves all this healthy tissue around it. So it's fractional, it's like a microablation, as it were. So, and then what happens is that healthy tissue contracts, it all tightens up, and you can do sort of what took 3 weeks of downtime. You could have 2 or 3 of the smaller, lighter versions called Cool Peel. So it's like a couple of baby ones, give you the adult, with a lot less downtime. So I love this treatment, and it's great for all skin types.
And what sort of problems does it treat? So it treats pigmentation, fine lines?
Yeah. So on the topics of skin, it's about really giving a nice, even skin tone. It's about helping with some of the pigmentation that can happen, improving the texture. We know we can't get rid of pores, but it can enhance the appearance of them. It can appear lighter and tighten the skin. So there are settings where you can do just the light, but also where you can actually deliver some thermal energy, which will tighten as well. So it's actually a great one for men. So men are doing it a lot because they'll come in on the Friday after work. They'll have this laser, and they'll stay on the weekend, and then by Monday they can go back to work if they have a gentle setting, and they'll have a few of these along the way, and they fly under the radar. Another example of what good work is to me. So I think it's being timed as well.
Now I'm going to ask you an important question before I segue to George, which is, are you, and I know you are you honest with your patients, and when do you say, this is a problem I can't solve, it's time to see a surgeon, and how do you recognize that?
I mean, I think we're all very ethical, honest doctors. Me, Dr. Christine, Professor Faraz, Dr. Pam. There is nothing in it for me to tell a patient or overpromise them. I think that patients have a tough time to start off with. I think that those social media apps track what you're looking at. So if something bugs you and you start looking at things about lips, this is an example, you will be forever bombarded with these pictures and with these pictures. And they're really good pictures, right? They're the good before and afters. And the patients come in with really, really high expectations. So the first thing is to have that chat and say, these are not reproducible in everyone. This is not going to suit you. So this treatment, just because it looks great on this photograph, is not going to suit you, and it may not last long. So it's sort of debunking the things that are being thrown at them of their own creation to some degree, but that is what's happening. People are being bombarded with these pictures. I think so being able to be honest with our patients is key, being realistic about what they can expect. But also, I mean, for me, and I know we all have different strategies, but we don't share before and afters. So that if you go onto our clinic Instagram, they're really tucked away. You have to dig through and really push through that. And we've put our settings so no one under the age of 18 can come onto our Instagram. I think that we all, as practitioners, are part of the problem. We're firing out these images left, right, and center. You know, we were all in our teens once. I had my insecurities. I can imagine sitting in a room being a bit, I feel crap about that, and then just all the time seeing it and seeing it. So we are part of the problem. We have to be careful about what we do. Some of the treatments, so for example, Orfaniotis, you have to see his work. It's beautiful, but that is targeting a totally different type of patients, the patients that come in for quick fix type of results with us.
And do you have a list of surgeons you then refer to? Because I know for a fact you've just referred somebody to
yes,
George.
I do.
Okay. And do people take... I'm never offended when... I'm having my eyes done in April, by the way, with somebody that Fran recommended, because you can always go to Fran for the best recommendations. You trust her implicitly. And that surgeon said to me, but have you considered a facelift? I'm never offended because I've got tough old skin and I've been around the block. Are people offended when you say, I think it's time to see a surgeon?
No, they're not. And I think that it probably comes better from me than one of their friends.
Yeah.
So I think that in that right setting, we're in a privileged position, our patients are in a vulnerable position talking to us. That is the time to tackle it in a soft way. I think where aesthetics or injectables can over-deliver as they promise too much of the word, my dreaded word, lift, there is only so much that we can do. And that is when I have to pass the baton to Mr. Orfaniotis. That's when you come along.
Thank you for that perfect segue, by the way.
Yeah.
Let's talk about when it's time to consider surgery. I feel that the aesthetic industry has exploded so crazily in the last 15 years that in some ways, great surgery has gone unnoticed and undetectable. When is it the right time to see a surgeon?
I'm the last resort. I mean.
But you shouldn't be.
I think there's a few categories of patients. The one Wassim just mentioned, the patient that was followed up by an aesthetic practitioner. They had treatments over the years, and we're very lucky in London that the taste of aesthetics is really good, and practitioners are also have the ethos to understand and not keep holding the patient and just giving them treatments. So I think that's the best referral for me, because the patients have tried treatments before and they've seen the limitations of these treatments, and it's time now to consider the next step, which is surgery. It doesn't mean that everyone is a surgical candidate, of course, but it depends how much it bothers you and how willing you are to have scarring, go through a financial investment to treat this problem. It's a big decision, and obviously, as for any treatment, things can go wrong. Then it's the other category of patients that they never had any tweaks, they never had any treatments, and they hold it, and they just said when they are on their 60s now it's the time.
I said to you backstage earlier on, didn't I? I said, if you ever get to the point in your life, and most of you are not old enough to get to this point, where you do this.
Yes.
There's not a lot of skincare. In fact, there isn't any skincare, and there's not a lot of aesthetics that can do that. But Mr. George can do that really well. Look at his Instagram. It's incredible.
Thank you.
But I also asked you earlier on who was the youngest facelift patient you've ever had and who's the oldest. And your answer spoke volumes. Speak about that.
I mean, the range of the age of the patients that we operate is now pretty much from early 30s to 80 years old. And I think that's concerning when you think that a 35-year-old patient is looking for a facelift. But on the other hand, you have to see why, because some of these patients, obviously, they don't have aging problems. They have congenital problems. Somebody was born with a heavy neck, and they had this since they were 20. So there's this category of patients, and people that they have signs of early aging, the DNA just make them age a little bit earlier. So you have to see the patient, what's the rationale behind it, and whether the benefits of surgery outweigh the risk and the stigma of having facelift surgery. The good news is that with the new techniques that we employ, such as everybody probably knows the deep plane facelift.
I don't think they do, George. Just
Yeah.
quickly explain
So deep
how
plane face-
far
yes.
technology has come on
Yeah,
and
it's
the artistry of what
a
you do.
technique that it's not new, but it's been employed over the last 10 years, mostly by American surgeons, and it just involves going to the deeper layers of the face and lifting not the skin. The skin is not been lifted anymore. It's just been removed, the excess skin passively, not pulling it. So all the lift is coming from the deeper layers, which is called the SMAS or the platysmal muscle, and therefore the facelift just restores essentially what we used to have at the younger age. So we're just putting things back to where they use. We don't putting things.
No more wind tunnel looks
Yes.
that we traditionally all grew up with, those famous Hollywood icons that just sort of suddenly came out
And
looking
that's
like
the worry
this.
of most of the patients that, they think about facelift. They have these pictures in mind from the 80s, 90s of, not mention any famous people, but everybody
them.
knows them. And they think, oh my God, I don't want this. I don't want anyone to think that I had a facelift, and that's a fear. And thankfully, by employing these new techniques and constantly refining them, we are able now to have a 90% of our patients that if you, even more, that if you look at them on the street and if you don't know them, you will never think that they had surgery. And some of the Hollywood stars that we're looking at, we know that they had surgeries because then we know their age, we know how they looked before, they are in the public eye. But if we just meet, we mentioned about Demi Moore, if you meet Demi Moore now and you've never seen before, she looks great. You'll never think that she had surgery. But
Okay,
we
I'm
all
going to be
know.
really contentious here. Do you think there's anybody in Hollywood, in the public eye, that hasn't had some sort of facial surgery?
There must be a couple.
It's true. Do you know, listen, for years I worked for Hello Magazine. It was my job to interview celebrities. And the minute you walked in, there was this suspension of disbelief that they would just tell you it was yoga, meditation and water. And you're like, you're my age and you look young enough to be my daughter. What's going on here?
Well, I visited a couple of surgeons in LA and we kept in touch, and they had this strike over the...
The actors' union,
The actors were like calling because they were striking to just book surgery. So they had to open lists on the weekends to operate on these people.
It was their perfect downtime. And we were also talking about the famous supermodel that's just met a certain age who had one during lockdown as well.
Yes, lots of people, the reality is that lots of people have it. And it's not as it used to be, the way the patients are seeing it, because it's a treatment at the end of the day. And if you think it's a quite natural treatment, it involves a knife and a scar. But if you put things back to where you're not adding anything, you're just putting things back and removing the excess stretchy skin. So, and also people are more open about it now.
Are they? Because I was going to say, because I think young people today are so open about their aesthetic treatments. They wear it as a badge of pride as opposed to my generation. Are my generation open about having surgery, or do they tend to hide that? I mean, obviously I will be covering mine in a video on my channel. I'm an open book, but most people aren't like me. Do most people want to keep it a secret?
You'll be surprised.
Really?
I have a lot of patients that they come in and I would never thought that they were private and they don't want the pictures to be published. And I asked the question, how would you feel if... I said, yeah, go ahead, I don't mind. And they know that, they will be in the public eye when they put a picture online, somebody else can use it, and they're happy about it.
That's
and
good.
That's great. I think when people are happy, they want also to share and give back the privilege that they had to see other results, because this is how, the market works. You need to see first the results, you need to see the work of a surgeon online, and this is the only way to do it. And it is very important in our industry.
How much does it cost?
It is an expensive treatment, so it can go up to 29K in my practice for a face and neck. So, but this allows me to dedicate on face and neck lift, and also allows me to not to bombard my practice by doing back-to-back surgeries. So I'm quite selective on what I'm doing, and I keep a healthy lifestyle for myself, and also I invest in the service, in the quality of the service that these patients will receive.
I know £29,000 sounds like a lot of money, but people willingly pay that on a car. And I think your face is more important than your car.
$250,000
I know.
surgeons in the UK.
In LA as well.
And there's so many people from London that they fly to have, surgery in the US. But I think there is a point that you become greedy. And if you cross that point, people are not stupid. They will realize that you became greedy.
What are you most excited about coming up? Is there anything new? For example, the Smash facelift, the deep plane facelift, completely revolutionized the way facelifts are done. Can you see anything new and exciting happening within your field?
Yes, I do a lot of other surgeries to complement. I think fat grafting, we had a discussion about it, and I think it's not for everyone, because not everyone loses volume, but it is a nice trick to make some
Explain what fat grafting is, George, sorry.
Subtle improvements. And also there is now new techniques in how you process the fat, like the nano fat, which it's great not only for volume but texture. And then, there's other aging. So you see, for example, a patient that had a facelift and they have an elongated lip. And this is a little bit, doesn't match the whole face in terms of rejuvenation. So you could do a lip lift, you could do brow lift, you could do a lot of things. And it's all going towards having a balanced, natural result. People want to look fresher, not necessarily want to look younger. A 60-year-old patient, doesn't want to have surgery to look like 30, just wants to look good. They're doing exercise, they have their treatments. It's extremely important to understand that all these treatments that our previous colleagues have discussed, they work synergistically with surgery. It's not one or the other. And you still need to, what is a facelift without good skincare? You'll be let down. You will see the patient have amazing, definitions and jaw lines, but, the skin doesn't look good. And you see a patient that has amazing skin, and they might not be great in the definitions, but they look healthy. They look good, and people commenting on that, you look so healthy just because the skin looks good. And then, machinery, devices, fillers, so many patients go back to the practitioners. I don't do non-injectable myself, so these patients, they go back to where the referral was coming from, and therefore they will continue this treatment. And it's extremely important to understand that it's not one or the other.
It's a synergy, isn't it, between all three of you?
Complete. And
Okay.
all this will give you balance. And I think we're very lucky in London. If you travel in other places, even in the US, I was in Dubai, and you see the aesthetics. And, you don't see these people in London. It's just a bit wild, what they're having and, treatment. So I think practitioners have the ethos to say, I'm not sure if you want the surgery, because, but go and have a chat with a surgeon and see what it involves. Have a look if you can afford it. But the problem that you have with your jowls, unfortunately, I cannot fix it. And if you're coming back to me and say that, put a little bit of filler, then you will get up to the point of no return where you have irreversible damage to your face, and it will be very difficult to have a surgical procedure. And that's why the filler has got a bit of a bad reputation, because it's been overused. As for any other treatments, if you overuse it, then you're going to end up, having problems.
We have 3 minutes left, so I'm going to ask you all the same question, right? And by the way, everybody's going to hang around if you want to speak to them afterwards, get a quick consult, they're here. Do you think the beauty business overpromises and underdelivers? And if you think it does, what do you do personally to counteract that? Mary.
First. So as a consultant dermatologist, definitely I think the beauty industry can really overpromise. We know that our skin is very dynamic. We'll have periods in our life when we're really happy with it, other periods will change. I think there are diseases that have an impact on your skin that skincare, beautification just won't help with. I think in my practice at South London, it's really important to work with the person in front of me, understand really their lifestyle. We know a lot of how we live our lives, what we expose ourselves to, has a huge impact on our skin. And also making sure our expectations are in alignment. And as a doctor, it's important for me to make sure that people understand what can be achieved in the time frame as well. People often want something, all of the skin problem to be gone next week because next week is the wedding and they've come to see me on Monday and the wedding's on Saturday. So it's understanding timeframes, expectations, and just also being kind to yourself. I think, as Wassim was talking about earlier, you know, we're living in this world where at your fingertips you can see images of people who have had who knows what done, constantly fed onto your feeds, and it can really magnify your own maybe concerns around your skin, your health, your life, all sorts of things. And actually sometimes just seeing a professional who can take it back and say, actually, this is what I expect someone's skin to look like. This is how we can help you is really important.
Wassim?
Pretty much the same thing. I mean, the majority of the chat's about expectation and making the patient feel that, you know, I understand you've probably been overpromised, happens within that consult. That initial rapport is really the make or break. That's when you have to be honest about what you can achieve. Like I said, patients are vulnerable in your hands. You're in a unique, very privileged position to have these conversations, and so you have to tread very, very carefully. So most of it is done within our consultation, spending a fair bit of time saying, this is achievable, this is not. In the wider scope of things, like I said, I'm very... We try and tuck away before and afters because I know, we all know how these social media algorithms work, and these are just going to be added onto someone's complexes and maybe expectations. So that's it. That's what we do.
George?
Yes, I think I haven't got much to add to this, but I think we overpromise because we do showcase our best work, and that's by definition, you know, people are trying to see themselves into that, and they expect. I think the quality of the lives of our patients and our quality of life depends on matching their expectations. And nobody wants a patient to treat a patient that they know that this is not going to happen. So consultation is the best place to have a chat which is honest. The patient say, listen, you know, if you want a facelift and your daughter is getting married in 4 weeks, it's not going to happen. Or, you know, if you want to treat whatever, if you want to feel like 20 years old when you are 65, ain't going to happen. So it's just a place to set these expectations so the patients can be happy and you can have a normal life. You don't want to be having, you know, patients not being happy. That's not gonna work.
Thank you, everybody. I hope you found that fascinating. What I want to do is I want to send you away not thinking that the beauty industry sells miracle cures, because it doesn't, but in the right hands with the right doctor and the right product, trust me, it can really deliver. So I want to send you away being a beauty optimist, not being a beauty pessimist. So thank you, Mary. Thank you, Wassim. Thank you, George.
Thank you.
And they will hang around and answer your questions.